Welcome to COVID Conversations on Friday, the 3rd of April. Today I'm talking with Michelle Gordon, who is a practice nurse support coordinator, and Elaine Gray, who is a practice nurse, about the difficult challenges of flu vaccinations in the time of COVID.
What we do need to convince or pass the information on is that it certainly is recommended, even more so now, to have the flu vaccine. It is a respiratory virus, so is COVID. And to have those together at the same time would be catastrophic. So we want to look at the health of all your patients, your family, your community, but we also need to consider the burden on the healthcare system. We don't know what that looks like. So what we have is a lot of the community wanting the vaccine now because they know about it. It's coming, it will be available. And then how do you manage those sheer numbers?
So when are the flu vaccines going to be available?
So from mid-April onwards, all practices should have stock then, which they can then maintain their orders themselves. So order what they need and what can fit in their fridges.
How's your practice going at the moment?
We're coping. We have 3 very dedicated nurses, some very dedicated reception staff, and lots of very, very dedicated doctors. And we have policies in place to make sure that we can maintain and optimise all the health for all of our patients.
What does that look like at the moment?
We're trying very hard not to have our older or immunocompromised patients come to the practice.
Yep.
And that is a boon with the teleconferencing that the doctors are able to do now. Those that do come, we actually have 2 outside field consultation rooms, and we have an outside waiting areas that the patients can be directed to. And it just saves them coming in and being in a closed environment for any prolonged time. And we're advising them if the appointment spaces are late, so that they don't arrive and actually have to sit within the complex for too long at all.
So first of all, what they need to look at is who are the people they want to get vaccinated first and how they're going to manage them. So we're looking at our vulnerable people, our old people, people with chronic disease. But then you don't want them coming into the practice when you might have COVID virus around. So it's managing the infection control side of things as well. So they need to start looking at the spaces in their practice where they're going to see these patients, and it starts from every member of the team. So if you have someone from reception, they need to know what information they give over the phone. They need to know what's on their answering machine, on their SMS reminders and posters. And then you need to look at your appointment schedule, how you're going to run it. What time of the day do you want these people to come in? When has your practice been cleaned? When can we get well people into the clinic?
Yeah, that's a really interesting point, that clinics need to be able to cater for well people and sick people.
We are trying very much to isolate the well and the sick. We're encouraging the really unwell people not to come, and that's where the teleconferences come in really, really handy, because you can actually give them advice over the phone, learn their symptoms over the phone, and just continue with their care in a committed and thorough way, but without having to compromise anybody else within your practice.
Brilliant.
And the thing to consider now with COVID is you also need to include your distancing, so your social distancing, and also your increased infection control measures. So a lot better screening has to be done. And so you're screening those COVID questions and then making sure that it's okay to get those people in at a well time to vaccinate.
What's the best idea you've seen?
If your practice doesn't have the capability of doing the social distancing and infection control measures, then we do see practices starting to think outside the box. So you are using extra rooms that are available, doing car park clinics, seeing patients in their car, or even using, if you're at a shopping centre, the outdoor area, and maybe sharing resources and having a few clinics within the same area, sharing those resources.
But just relax and breathe, we'll get through it.
Thank you, and thank you both for talking today. Thank you for joining us. We'll see you next time.